Thank you for watching our training for the Spiritual Care Assessment and Intervention Framework. I'm Alexia Torkey, Director of the Daniel F. Evans Center for Spiritual and Religious Values in Healthcare, an Associate Professor of Medicine at Indiana University, and a member of the Regenstrief Institute and IU Center for Aging Research. First, let me give you an overview of what we will do today. I will provide an introduction to the SCAI Framework. Then Sanita Michael will present a chaplain researcher's response to the SCAI experience. Finally, Emily Burke will describe your participation step by step. In spite of a long tradition of spiritual care in the hospital, there is little research on the outcomes of spiritual care. Recent reviews have identified a total of only 7 interventions. One example is a study of the effects of chaplain visits in COPD or emphysema. These patients received daily, unstructured chaplain visits, and they were found to have lower anxiety. Another study conducted at Methodist Hospital in Indianapolis looked at the effects of pastoral care services on outcomes for patients receiving CABG, or coronary artery bypass graft, at Methodist. They received a structured intervention protocol that included 5 visits, each with a specific focus. This study showed an impact of spiritual care on both positive and negative religious coping. So in summary, in spite of its importance, there just aren't a lot of studies that show the outcomes of spiritual care. We wanted to conduct research that continued to extend that literature and showed how important spiritual care was in the clinical setting. And so we conducted a project called the Chaplain Family Project. We developed a chaplain-delivered intervention to provide spiritual support to family members of seriously ill older adults. Now, in order to conduct research on spiritual care, we had to develop an approach that could be reproduced in other settings. In other words, for the research to be rigorous, we had to have a reproducible intervention. However, the approach also had to be useful in the clinical setting and for the education of chaplains. So we perceive that developing a chaplain intervention is really a delicate balance. On the one hand, we need something that is rigorous and reproducible, and therefore has to be somewhat structured. On the other hand, spiritual care, as all of you know, has a tradition of being open-ended, responsive to the individual, and unstructured. The SCAI intervention has attempted to balance both of those important needs. We developed our new framework with an interdisciplinary team that met regularly over several months. The teams included chaplain, healthcare leaders, a physician, and research staff. We developed and reviewed the framework and then pilot tested it with 25 participants. We then refined it with feedback from the team and tested it out with 8 hospital chaplains. We then further refined it based on their feedback. Next, I will describe the parts of the SCAI framework. First, we will have you ask semi-structured questions about 4 dimensions of spiritual care: meaning and purpose, relationships, transcendence and peace, and self-worth and identity. We will then ask you to assess the person's spiritual needs, in particular their spiritual strengths and spiritual distress. You will then document the content of your response to the individual and provide interventions that address their spiritual needs. Finally, you will evaluate the outcomes or in other words, the effect that your spiritual care may have had on the person, and identify next steps. As I talk about the SCAI framework, we will certainly expect that some of it will be familiar to you, such as beginning with an assessment, developing an intervention or response, and noting the person's observable outcomes. The difference with SCAI is that some aspects of it are more highly structured around specific dimensions of spirituality and suggested questions, and we will ask that you document your interventions and observations in a particular way. I'll go through each of the 4 dimensions in a little more detail. Dimension 1 is meaning and purpose and includes values, beliefs, understanding of life events, the actions of God, others, and self. For each of these dimensions, we have listed questions, and we are going to ask that for each dimension, you use at least one of these questions. We ask that you use the questions verbatim as they are written. That's the part of the framework that is structured. However, you may respond to the individual's answer as you ordinarily would, by probing with further questions, exploring important ideas further, or whatever you think is most appropriate. Dimension 2 involves relationships. connection to community, family, others, and God. As you can see, for each of the dimensions, we've listed questions. So for example, for this one, you might ask, who is there for you at a time like this one? How are they important? Or how are you connected to others during this health crisis? As you can see, we've listed multiple questions for each dimension. We certainly don't expect you to use all of these questions. A certain one may seem appropriate for a particular patient or for a particular situation. So we hope that from among this list of questions, you'll find some that you like and that feel right to you. Dimension 3 addresses transcendence and peace, the experience of the divine, ability to be centered and aware, and practices and behaviors that increase or decrease transcendence and peace. One question we've taken from the literature that has been validated in the past is, are you at peace? Another question is, what do you have faith in? And finally, the fourth dimension, self-worth and identity, or the sense of belonging, being loved, and capacity to be self-aware. This includes questions like, how do you feel about yourself? Or, do you feel valued? As you ordinarily would, you will respond to the patient or family member's concerns with spiritual care interventions. We will then ask you to document two aspects of your interventions. First, the content of your response, and then specific interventions. The content of the chaplain's response will include the concerns you choose to address and your response, such as what's prayed about, the verse chosen, or the empathic response to expressed emotion. For example, if a family member who describes herself as a religious Christian expresses a lack of support and loneliness and requests prayer, the chaplain may pray for connection to God and others. We also would like you to document the specific interventions or actions that you use, such as prayer, reading scripture, or active listening. We have developed a list of these interventions based on the literature describing chaplain practice and on the experience of our chaplains. Next, I'd like to introduce Sunita Maiko. He is the research chaplain at IU Health Spiritual Care and Chaplaincy Services. He worked with us to develop the framework and was the main chaplain who implemented the framework in our pilot study. So he's had a lot of experiences that he's going to share with you next.
Thanks, Lexi. At this time, I'm going to share a chaplain researcher's SCAI experience. Before I started using the SCAI model, 4 questions emerged. The first question was, is this going to be different from the clinical method? Clinical method is action, reflection, application, and integration of chaplain training. How is this going to be different from our usual practice? I also was wondering, how am I going to remember measurable indicators that would support the care I provide? And lastly, I was also concerned, how will this be applicable in the real world? So, what was it like to use the SCAI framework? My impression after using the SCAI framework was that the clinical approach was enhanced. SCAI is a more structured framework that is easy to use. I also found that SCAI is an outcome-driven, clearly articulated way of doing clinical intervention and documentation. So what are the things to be aware? Chaplains are not trained to carry notes to an encounter. Carrying the pocket card could initially be a challenge. Chaplains historically have not been trained to do an intervention with hopes to assess outcomes. A well-thought-out approach in using the SCAI framework may be misperceived as time-consuming in care and documentation. So, significance of the SCAI framework for our profession. As many of you know, within literature, we don't have many frameworks that have been developed to conduct this kind of research interventions. So this SCAI framework is going to contribute to current literature. The SCAI framework is easy to use and assess effect on care recipient. Having used it before, I know it was very easy. It helped me really to ask the right question and also to track the effect of the intervention that I provided. Our hope is that the SCAI framework to enhance the spiritual care that patients and families are already receiving. At this time, I would like to introduce our colleague, Emily Buck, Research Coordinator, Reagan Street Institute IU Center for Aging Research.
Hi everybody. At this time, if you have not done so already, please access a copy of the SCAI Framework so that you may follow along. The SCAI Framework is a toolkit for spiritual care delivery. Upon first glance, it may look long to you. This is one piece of feedback that we have received from our pilot study. There is a good reason for this. In designing the SCAI Framework, we wanted to try and include all of the most common dimensions, questions, interventions, and outcomes that chaplains see in their day-to-day practice. Imagine having a toolbox that had every tool you could use for your trade. That is what we want the SCAI Framework to be for chaplains. Remember that we did a long literature review to identify all the major themes recorded in spiritual care delivery, and now we want to build on that based on feedback from you. So while it may look long, understand that we want you to have the freedom to choose individual items that would be most beneficial to the individual that you are working with at that moment. If you feel that there is a question that is not included in the framework but could be, please let us know. Now I'd like to break down your participation into 3 easy steps. As I said, your participation will be completed in 3 steps. The first of those steps is what you're doing right now, which is completing the training. So thank you for your interest in using the SCAI Framework. The next step is to try out the SCAI Framework in your clinical practice setting. And the third step is to complete a qualitative phone interview with me. Below is my contact information. After you've completed this training, please email or call me to let me know that you'd like to participate. This way we can track those individuals in order to set up qualitative interviews. This information will be shared at the end of the slide presentation as well. Now I'd like to tell you a little bit about how to use the SCAI Framework in your clinical practice. It would be ideal if you use the framework with all of your interactions with a particular patient and/or family member. Try it out during your first visit with 3 patients or family members in your usual practice setting, as well as any follow-up visits with those people. The SCAI Framework was designed for use with adults. If you provide spiritual care to children, we encourage you to ensure an adult family member is present and able to participate as well. Use the pocket card or guide during each visit. For some chaplains, this may feel awkward initially. However, pilot data did not indicate that families were bothered by a chaplain's use of the pocket card. If you feel inclined, you can explain to them that you are trying out a new tool that supports your work. Pay particular attention to aspects of the framework that you like or dislike. Enter a note into the EMR as you normally would. The intervention is completed in 5 steps. The first step is to ask assessment questions. The second step is assessment documentation. The third step is the content of your response. The fourth step are the interventions that you provide to the patient or family. And the final step is documenting any outcomes that you observe during the visit. When implementing the SCAI Framework, we ask you to address at least one question from each dimension while delivering spiritual care to patients and families. The second step, assessment documentation, is where you identify and assess qualities of the patient or family member based on their responses to the questions you ask, and also identify their spiritual needs. The third step of implementation is the content of the chaplain's response. This is a place to dictate how you responded to the patient and/or family member's strengths, distress, needs, and current circumstances. Essentially, we're asking, what did you say to the participant, and what did you do for the participant? On the SCAI form, there's an open text box that gives chaplains the ability to record a narrative about their experience with the patient and/or family. The fourth section, interventions, is a list of different interventions that chaplains commonly provide to patients and family members. Examples of these are prayer, active listening, reading from scripture, etc. The final step of the SCAI Framework is outcomes. This is a list of outcomes you might have observed with the patient or family member while providing spiritual care. For example, if you're working with a family who has just experienced the loss of a loved one, you might use the outcome of reflection or acceptance of loss and grief. The outcomes are tied to specific dimensions. You may observe an outcome that is tied to a question from another dimension rather than the one that you initially asked. We recognize that many of these questions and outcomes may be interrelated. You may also observe and document other outcomes that are not provided within the framework of SCAI. After each visit using the framework, write a few notes about what you like and dislike, any additional interventions or techniques that you use with the participant, or additional questions that you think would be a valuable part of the framework. The final step of your participation is to complete a qualitative phone interview. You will schedule and complete an approximately 30-minute audio recorded interview with research staff about your experience using SCAI. This interview, as I said, is qualitative in nature, and it will be used to elicit feedback and recommendations on how we may further improve the framework. We value your opinion and expertise. We hope that you will see this as an opportunity to contribute to the field of spiritual care research. We'd also like you to provide valuable feedback that will make the framework more comprehensive for chaplains and help us identify the items in SCAI that are most supportive and helpful for families. Now I'd like to provide some final tips on implementation of the SCAI framework. The framework is semi-structured, so you can go off of the framework if that is what feels best to you. While we want the questions in the SCAI framework to guide you, you can also ask other questions that are not included in the framework. Please note those questions so that we are aware of the questions that you used. Not all questions are appropriate for every participant, and we ask you to use your discretion in determining what would be best or most helpful. You can use the dimensions in any order, so you may begin with self-care and then jump to meaning and purpose. That again is completely up to you. If someone answers a question that has not been addressed in one of the dimensions that you have discussed, that still counts and you don't have to ask those questions again. In the first visit, we'd like you to ask a question from each dimension of the SCAI framework. However, we understand that sometimes due to time constraints or other factors that might not be possible. In those cases, just please try to address those dimensions in a follow-up visit. Additionally, in follow-up visits, you can ask other questions from different dimensions or revisit the same topics from the first visit if that feels best to you. One thing that we'd like to stress is that your participation and responses are voluntary and confidential. All information that you provide will be de-identified. At this point, we'd like to thank you for participating in the SCAI training. Please be sure to email or call to let us know that you plan on implementing the SCAI framework in your usual practice setting. You can see here my contact information. Also, let us know if you have any initial questions, comments, or feedback. We'd love to hear from you. Thank you so much.